Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of our Good Samaritan Physician Network. Joined with me, as always, Adam Thacker, who is our Chief Operating Officer of Good Samaritan Hospital. We'll be giving you our weekly COVID update, a little discussion as to where we have been, where we are now, and where we're headed over the course of the next few weeks. The numbers continue to be good when we look at total course of the time from when we started roughly a year ago, which is kind of hard to believe. Roughly 3,500 cases that we've had total, but the really important numbers that we look at every week are those positivity rates. 1.9% for all individuals tested and 9.1% for the unique individuals. Those numbers continue to be low. We're in blue status as far as the counties within Indiana. And then roughly, sounds like 17 active cases we've had, which has ticked up a little bit. But when we rewind the clock, as recently as 4 to 6 weeks, we were in the hundreds of active cases. So that's spectacular change.
Right. Still really good numbers. And I think last week we were at maybe 9 active cases. And so you're going to see some fluctuation in that range, but certainly continuing to see really low transmission across the community. And probably the most important piece of those active cases is out of 17 active cases, we currently have 0 cases in the hospital from a COVID standpoint. So those cases are recovering at home, have really what we would call mild to moderate illness, just some symptoms, and are quarantined, being followed by the health department appropriately. So that's to be expected, and really that's going to be long term. We're going to see a few cases.
Yeah, as we kind of back the clock up as to when we started this process 12 months ago, we had a few cases here and there, and as things ramped up and we got more community transmission, obviously the spread of those cases was greater. The same is true as that backs back down. So the number of active cases in the community is still very important because the likelihood of that transmission is lower when we don't have as many active cases. One of the big factors contributing to all this is vaccination rate. And basically, if we go back to the beginning of this and looked at what we thought we would have vaccinated by this time, we've blown past that number tremendously. And it's been greatly in part to the allocation that we've gotten has kept up with the numbers that we needed, and then the functioning of the vaccine clinic, which has been great.
Yeah, we now have 3 sites open in Knox County with Walmart gaining vaccine through federal allocation, and then the health department and our site here at Good Samaritan that's been up since mid-December and vaccinating. So at Good Samaritan, over 15,000 vaccines have been delivered, and we continue to see now the state eligibility moving at a quicker pace. We're at 50 years of age and older, and then our first responders, healthcare teams, as well as special populations, those on dialysis, active cancer treatment, Down syndrome, sickle cell are included as well, and they're being notified of registration. So looking this week, we have hundreds of open appointments in our vaccine clinic. So we really expect that, and looking across the state, that holds true. That's not unique to Knox County. So we really expect this week that 50 is going to move to 45 in kind of these 5-year increments, and then 45 to 40 ideally by the end of the week. And a lot of that hinges on what you mentioned. We've had a good steady stream of supply of vaccine. The Good Samaritan Clinic utilizing the Pfizer vaccine, we've been able to stay ahead at really all times of what our demand was, and we expect that to continue to be the case. And now that there's a third vaccine approved in the J&J vaccine, the single-dose vaccine, we don't have a time frame of when Good Samaritan will have that vaccine, but we do expect sometime towards the end of this month and certainly into April that we will get that. And then some additional utility comes into play that we don't have to administer that through a vaccine clinic where you come back for a second dose. It's one dose. It's refrigerated. We can be more mobile, get that out through some of our medical practices, and potentially host mobile sites where we can go out and reach some populations that maybe have a more difficult time traveling in to the clinic, or are homebound, at-risk types of individuals that we can really go out and make a difference with.
And looking at the populations, as you said, things have continued to roll and open up more. A lot of that has been we want to make sure that each of those populations has had enough time to sign up, get the vaccine, and then as more slots have opened up, I know that you communicate with Indiana State Department of Health every week, and as those communications continue on, they're kind of getting an idea of statewide what the availability is in terms of open slots, and then they continue to roll those openings.
Right, and I think across the state we're at a point now where we're looking at how do we get more, how do we push that. So I really expect the state to look at increasing that eligibility, and it's easy to look from state to state and draw comparisons. Some have went age-based just like Indiana, some have went age-based plus some essential workforces, and there's really not a right or wrong answer. But if we move fast enough from an age standpoint, it does start to encompass all of our adult workforce population. And what's important with that is outside of youth that are at risk due to some of those special conditions that we mentioned, potentially transplant or cancer, those types of things, the younger population have done extremely well against this virus in general. They recover from asymptomatic to mild symptomatic, very few hospitalizations and very, very few deaths in a younger population that doesn't have otherwise health factors. So certainly if we can move quickly with the age base, we're hitting the most at-risk populations quickly, and that's really our goal.
Yeah. And the other thing that we have talked about intensively in the past, which has become a little bit less of an issue lately, has been the monoclonal antibody infusion. However, we still want to make sure that people understand that if they develop symptoms, if they are concerned that they potentially have contracted COVID, to get in touch with your primary care provider, get to our local convenient care clinics, and get tested. Because one of the other things that we have seen recently is a little bit of an uptick in the number of flu cases. Now, we have just a microscopic fraction of the number of flu this year that we've had in years past. So typically in Indiana and in the Midwest, the majority of our flu season hits in kind of January, February, March. We saw virtually no cases up until just recently.
Right, and as you mentioned, just in the numbers, so this year we've had a handful, 3 or 4 flu test positive out in our community, and this same time last year we were over 1,000 flu cases that we had tested positive through point of care at a convenient care at a medical practice. So such a stark difference in that, and certainly the distancing, the hand hygiene, the masking have played an instrumental role in shutting down virus transmission, as well as travel. Even though we've started to open up travel again, many people are cautious of travel, and certainly international travel has been much less. And so we've seen that effect on all viruses, not just flu, but on all viruses, and really leading to a diminished results in those, which is ultimately a good thing, a healthier community. But it is important to note that you can go out and look at the internet very quickly, and your leading scientists, CDC, who will very quickly say that doesn't mean wide open everything up. I know some states have made the decision to move to 100% open and removing masking. I will say that we're watching those states very closely to see what happens. And really, Indiana has said at least through March 31st, the executive order stays in place with masking, with distancing. We don't know what April 1 brings. That's being discussed at a state level. I do think that there are starting to be those discussions of how do we relax the restrictions that are in place. And I'm excited that we're having those discussions and moving in that direction. But at least for the next few weeks, we still have an executive order in place, and still really just appealing to everyone to be diligent during this time.
And certainly, just as things ramped up, we anticipate that will be a scaling down process as well. We don't think that the sheet will be ripped off and everybody will be open and free and no masking and so forth. However, what will likely happen is as things gradually kind of spool down, the numbers continue to look good, those conversations will be no masking whenever social distancing is possible, and in more outdoor open venues, places such as that. And then as that continues over the course of the next few months, we'll see that soften and lighten up. As Adam said, one of the nice things that we've seen early in this pandemic and through the course of it is we've had other examples as we've kind of watched throughout the United States and around the world to see how certain other policies have played out, and we'll get an opportunity to watch that as well as other states open completely up all at once, and we see what their numbers do as well.
Right.
We've got a number of things that are working in our favor, not the least of which is we are coming out of the winter, we are coming into spring. People are less indoors, they are more outdoors, and just the fresh air associated with that and the general health for both mental and physical wellness improve. And so we anticipate that that will continue to be the case as we roll into March and April and May.
And as we talk about relaxing and doing that in a mannered fashion, we have made some changes to our visitation policy yet again. As you mentioned, we're blue, low transmission in the community. So as of today, we have opened up visitation to 2 visitors in the inpatient and outpatient settings, so really across the all aspects of care. And then there are exceptions such as end of life where there would be more visitors allowed. But we are constantly looking at that, working with Southwest Indiana to be consistent and trying to balance that, having family involved with their loved one's care, as well as still being aware of traffic in the hospitals and just keeping traffic down. One really important factor to us being able to increase visitation is that if you are coming to an area where you're waiting in a waiting room, waiting on somebody to get out of surgery, waiting on a test, waiting a procedure, whatever the case that may be, even if you do have 2 visitors, we still need to sit in those households or those that are coming in together and not everybody congregating. So you'll see some of our seating has been adjusted to assist with that and spaced out more, and need everybody to follow those guidelines so we can continue to have those visitations that we have today and even be able to expand upon that further in the future.
And as we move forward, we want to surely make people aware that we still want everybody to follow the same types of precautions. As we loosen up as far as visitation is concerned, as things continue to open up locally as far as restaurants, retail, everything else, we want to be cognizant of that. And as Adam said, family groups are still very important to make sure that you're looking at what that circle of people is that you are around. As we've spoken about in the past, we've got spring break coming up. People have plans for travel. We want them to take into account, regardless of where you're going, to still consider that circle of family and circle of friends that you're within, because those are the people that you've been exposed to the most and have been exposed to you also. So we want to make sure that that stays intact, and then as we roll forward, we'll continue to see that loosen up. One of the subjects that has been brought up and we've had some questions about in the past is the vaccine efficacy, the new types and genetic variants that have come up, and some discussion about what about getting vaccinated, being positive after being vaccinated, maybe having symptoms with that, maybe not. And so I think it'd be nice to talk a little bit about that. And then also one of the other important things as we talk about the antibody infusion is how that plays into this whole situation.
Sure. Well, from a vaccine standpoint, the initial vaccines that were rolled out were 2-shot vaccines, and you're considered protected 2 weeks after your second dose. So Moderna is 28 days between each shot, or within a range of 28 days, and then 2 weeks after that are considered fully protected. Mm-hmm. Pfizer is 21 days, and then the same applies 2 weeks. That allows your immune system that is responding to the vaccine to build up the antibodies to offer that full protection. And now we have the J&J vaccine that's coming in. It's 1 shot, but you still have that 14 to 28 days post the shots before you are considered fully protected. Now, at that point, fully protected, all of the efficacy is based off of what we would call clinical illness. So keeping you out of the hospital, keeping you from becoming clinically ill when you come in contact with the SARS-CoV-2 virus. It will not keep you from testing positive. So we've had some individuals in the community that have been vaccinated, are post the 14 days, are fully protected, and they went to one of our providers, physician, nurse practitioner, and had some symptoms, maybe COVID related, maybe not. But out of caution, we still test pretty much across the board because every symptom has been tied to COVID at some point. and they test positive. Immediately there's almost a gut reaction of the vaccine's not effective. Well, the vaccine's effective because you have to look at, you may have been in the hospital if it weren't for the vaccine. You have to look at that symptom, if it was a GI symptom or a runny nose, headache. That can be, headache in particular is attributed to a lot of COVID, but there are tons of reasons for headache, especially this time of year, weather changing, seasonality reasons. So testing positive is still is something that anybody that's been vaccinated, you, me, anybody that's been vaccinated, if you come in contact with the virus is in your body, the test will detect it. But the clinical illness is where the mRNA vaccines are 95% effective in stopping clinical illness. The new J&J vaccine is 66% effective in preventing mild illness, but all three vaccines are 95+% in keeping severe illness and keeping patients out of the hospital. So that's really where we have to look at that. Efficacy is keeping us from becoming sick, not from testing positive. And there seems to be some misconception of vaccine doesn't work because I tested positive. Doesn't work that way.
And really, the where the rubber meets the road on that is looking at what our inpatient population has been of COVID over the course of the past 3 or 4 weeks or so. So we know as back in December and prior to that, the hospital was full of COVID. ICU had patients full of COVID. And what we have seen since the vaccine has been administered is certainly less severe illness and less hospitalizations, and now no hospitalizations. And so really that's what this is all about. I think the words preventative and protective sometimes get mixed together a little bit too, unfortunately. And the vaccine itself is not necessarily going to keep you from getting the virus, and even when we look at the variants and things that are changing, but if it keeps you from getting a less severe clinical illness, keeps you out of the hospital, that's really what our goal is. And the exciting thing is the further that we get into the vaccination program, the further along that we get, and the more of that high-risk population that gets vaccinated, as Adam said earlier, our younger population, our less clinically ill population that doesn't have a variety of other comorbid factors, we're not as worried about them becoming as sick with the virus. And so it's our population that is older with multiple medical problems that we worry much more about. So more and more of that population has been vaccinated, less and less active cases in the community. So as we roll forward with that, that's really what our goal is with this. So we want to make sure people understand that just because somebody tests positive, that's not necessarily the significant factor after they've received the vaccine. It's what was the status of their clinical illness.
And you mentioned variants. I think I've also heard, well, if they tested, does that mean that they had a variant? And when we talk about variants, there have been a couple, three variants that have been somewhat publicized as being out there and detected. The test that we run will capture a positive test for any SARS-CoV-2. It does not tell us if it is the original strain, the UK strain, South African, Brazil strain. It doesn't tell us that. That actually has to be sent off for genetic testing, and I don't believe there are even labs in Indiana that are doing that. It has to be sent out to some of the very large national labs. It takes time to do that. I know there's been some local news about sending off testing for variants, and it's good to understand if those are in our community. But what's important is the predominant variant, the UK variant, the vaccine is just as effective as those numbers we quoted a little bit ago against protecting it in the vaccine. The other variants have shown a diminished efficacy, but they are not very prevalent. There have not been any discovered in Indiana at this point. Will there be or won't there be still remains to be seen. We're still in this race, and it's a race of vaccination versus transmission. And the faster everybody that's eligible gets vaccinated, signs up, and whether we'd love for you to come to our clinic because we have next day, same day availability starting this week, or if you drive an hour away to get vaccinated, either is fine. But when you're eligible, get vaccinated, be in that race to vaccinate side, and then we can slow transmission, which ultimately is what stops mutations and variants, is by getting ahead of it and not letting the virus be transmitted from individual to individual.
And locally, when we add up the number and the percentage of our population that's been vaccinated to the population that has tested positive, that herd immunity number. We're growing closer and closer and closer to that. And Dr. Stewart has commented on that many times, that's really the mass, the critical mass that we're looking at. And we don't need 100%. We don't need 90% to reach herd immunity. What we want is the higher that percentage, the less likely that we're going to get continued community spread. So thank you for everybody who's participated, who's got signed up, who's gotten vaccinated, and continues to stick with our precautions. We're getting closer. Things continue to get better. And as we look at those number of active patients and the lack of patients that we have in the hospital, those are all encouraging numbers to all of us. Any other things we need to cover before we hit the phones?
I don't believe so.
Tiffany?
No questions.
A paucity of questions today. Very good.
We were very thorough.
I guess so.
The question was something that you started to address on your own anyway.
Okay.
Well, thank you all very much for joining us. Again, we'll be with you maybe in a week, maybe not, and we'll catch up with you then. Please continue to follow your precautions and get signed up. Again, lots of availability starting this week in the vaccine clinics, and we'll see you again in the future. Thanks.